Is it because of the mass outreach program, which is being led by Pinarayi-led and the CPM?
Yeah, thank you so much, Sudha, for the nice words. Definitely, I'll talk science, only science. So this time, I think I'm going to disappoint you. I think, there is absolutely no necessity for any kind of restrictions at the moment in Kerala. You see, what happens is that there is a slight increase in total number of cases in Kerala, but there is no point in keeping some restrictions at the moment because we have found out a subvariant of Omicron here, and a total number of cases, is not picking up very high. This is a season of some kind of respiratory tract infections, especially in November, December. We all in all these years we used to get some increase in number of cases during this period. That is the first thing. The second thing is there are some COVID cases. There are some H1N1 cases, viral fever, dengue, and also this thing, leptospirosis, and common viral fever. All these things are here. There is no peak in COVID cases. Now, and most importantly, these COVID cases. See, I'm an ENT surgeon sitting in right in the city, in the heart of the city, and I can see that there is not at all no increase in sudden increase in COVID cases. There are cases, but then it's very mild only. Most of them are asymptomatic or mildly symptomatic. There is no casualty. I mean, like intensive care unit admissions or any patients required. Even admissions are not required at the moment. So I think if you look at the data all over the world during all these seasons, whenever there is a sudden uptick of COVID cases, you can see that these uptick came back all of a sudden, maybe in few days or maybe in another week or so. And if you start implementing the restrictions all of a sudden, it will create a panic all over the state and probably in the country, and there is no necessity at all. We are absolutely sure that this small peak will come down maybe in another few days. That is
I
what
mean,
we expect, and that is science also.
yeah, absolutely. And I so wish that that's true, but also let me ask you before I go to Dr. Jayalal, is that the cases were found in Tirunandapuram and Kannur. Am I right? I mean, the JN.1, these two cases. Professor Jayalal, I want to ask you that, why is it then? First of all, prevention is better than cure, is what you doctors have taught us all our lives, right? Although a lot has been written, about COVID, we are still figuring out. And I've spoken to doctors like Rajiv Jaydevan. That day he was on my show. He said, "Listen, I don't know." At one point, he said, "We do not know. We're still learning." I look at it from the prism of science, but it's mysterious. It keeps changing. It's like avatars. You keep changing. The point is, if you look at neighbouring Karnataka, like I said, masking up has become mandatory. I mean, you are being ticked off now by, volunteers. Very soon, maybe there will be marshals also. Children, their temperatures are being taken. Don't you think that Kerala, of course, there is a political reason which is being attributed, that if, the government decides to have a mass outreach program, then obviously, and also Sabrimala, if you see, your mind will boggle, Dr. Jayalal. 1 lakh people jostling, all men, all of them, there is absolutely, it looks like scary. Don't you think that there should be some restrictions in place, doctor?
Yeah, I fully agree with you on the points which were raised on the need for the preventive step. Because the number is started increasing, the testing is becoming, the number of tests they have done, and the positive rate of the testing is 30%. That is a relatively huge number. That means a lot of people are not testing that when they have this cocktail of cough with fever and body pain, they are not testing. They think it is an influenza. They think it is a common cold, and they are not doing the testing adequately. So number of samples tested, 30% of the samples are showing that it is positive, and 265 case rise is absolutely a large number, and we need to take some preventive measure. On the other hand, Kerala is a one state where there is a public health system is well developed, Even the interior or the remote areas of the Kerala, we have all the infrastructure, healthcare problems are there, and they are used up to such situation. They are the state which has reported on the Nipah. They are the state reported the first COVID, and the people are also more educated, so they know for themselves the masking and saying the restrictions are not only on the COVID or the pretext of the COVID, but in this era of this more number of influenza, cold, and common cold is spreading, the masking is a better option. So I personally believe, and the masking shall be advised, shall be instructed, or shall be even make mandatory for the people who are when they are coming to the common place or the common the mass gathering. Absolutely, there is no need to panic. It is only a variant of interest. It is not even a variant
Absolutely.
of concern.
Yeah, so I mean, but
So,
the restrictions are not in place. That's the truth, and it's good that you have thrown some light on it.